service. As per normal Muddles, please do put your questions and comments in the chat, and we'll collate them and address them either as we go through the session or certainly at the end anyway. So, and obviously any feedback or any other comments, please do put them in. And obviously Eid Mubarak to all our colleagues who celebrated Eid al-Adha over the weekend. I saw some great fireworks and sessions and people really celebrating it, so that is great to see. And today you'll all be glad to know is National Blueberry Muffin. Who would have thought it? Or National Mojito Day, which might be slightly more appropriate given the hot weather that we are in. So we'll move on to where we're at from a trust perspective, and we had comments from Julian Hartley last week about the fact they had to cancel the Time to Shine Awards due to the fact that it was felt unwise to go ahead given the large increase in community prevalence of COVID at the moment. And therefore the exec team are planning to get out and about and meet the winners and present awards from tomorrow onwards. There was shared at the tactical feedback on the Friday morning to the rest of the trust as well on the great work everyone's doing on the recovery and reset programme, looking at reducing our long waiting lists as well as outpatient waits that we've got as well. We've had great recognition from NHSE that came to visit us, but also we had a trip down to Parliament last week where I was able to support the Building the Leeds Way team and the Linda Pollard, our chair, as well as Julian Hartley, our chief exec, in gaining lots of support from MPs both within Leeds and around West Yorkshire and wider afield, and they were pledging support for our project as we go forward with making sure that we get the funds for our Building the Leeds Way project moving forward. We have seen an increase in COVID numbers within the trust as a whole, and that is obviously impacting on services, not least in our people providing care for adult patients with COVID, but also in our staff, which has meant it's very difficult in the Children's Hospital to carry on the same level of activity that we have at the moment. But because we've had staff off, we have had to reduce certainly our bed capacity in certain areas, as well as the amount going through theatre because of that. Penny Luthwaite, the head of our IPC within the trust as a whole, certainly in our adult areas, was glad to see that some people are still wearing masks in corridors, despite the sort of current change in recent guidance due to the increased numbers of COVID around, and obviously keeping our distances and wearing our PPE appropriately for ourselves and patients to keep them safe would be a good thing going forward. They're also, from an IPC point of view, gearing up for the fact that because of our increased numbers in COVID, we're not taking the eye off the ball. We're also still already planning our flu season ahead and noticing that that will impact on our services going forward. So that will come around very quickly anyway, but if you are offered the flu vaccination, certainly from my perspective, I'd be grateful if you are willing to engage with that programme. We have seen it is helpful to try and keep our staff numbers to the maximum as we possibly can do. We have also seen our MPX numbers within LTHT, small numbers testing positive. It has been, however, changed, and it's no longer classified as a high consequence of infectious disease, and that there is a supporting vaccination programme in place within LTHT until that's taken on by the community. There's a big bit of work happening around our outpatient transformation, and obviously as Leeds Children's Hospital, we've been leading the way on Bookwise and making sure we maximise our capacity within the Children's Hospital, but that's also been incorporated across the whole of the LTHT as well, but I'm very grateful for our teams leading on that going forward. There's still been the drive as well to see as much as we can do virtually, and obviously that has both economic but environmental benefits at the moment as we look at fuel prices increasing and financial hardship for lots of our patients and families, that if we can deliver it virtually, it will obviously decrease on their costs for that, as well as having the environmental impact as well. So a real drive, if we can, to do things virtually, then continue to do that. There is a workshop that's happening this Wednesday at 5 o'clock, and there are two people talking about it. One, Ian Eardley, who's our adult urologist, who's looking and involved with NHS England about the elective recovery of outpatients, and the national asked for local implementation, and Ian will talk about that. We also got John Steele, who's the clinical director for the Leeds Dental Institute, looking at a successful approach forward with clinical validation, and we'll post the link to that meeting, and that's open to all clinical and non-clinical staff within LTHT. So anyone that's passionate about changing and transforming outpatients, then please do let us know. So that's where we are with the trust as a whole. I will there's been no specific discussion regarding bronze today. I think there was going to be an update, Laura, if you are.
Yeah, I can just quickly update. So we weren't able to get together actually last week for bronze, Colin, you might remember, because of the surge planning that we were sort of pulled into. But we have received something for discussion really and review from Sarah Hibbert and Elaine Edwards. So just to make sure that they're aware that that's still on the agenda for today, and that's just around the new updated AGP guidance and how we might kind of operationalise that in terms of the PPE for physiotherapists. So that is on our agenda for today. Then would you like me to move into the operational pressures? Yeah. So last week, I'm sure you will all remember that we went into surge 1 of our surge plan. So that was where we were had identified moving into additional beds on L40 should we need them. You might remember that we kind of came into a position on Monday where we had 11 inpatients that needed a bed within the CAT unit and no available beds. So it was a really tricky sort of start to the week. So we've activated that plan really and identified those beds as our first phase of surge. In saying that, we did manage to maintain the majority of our elective activity despite being in a surge phase. So just to sort of really acknowledge that we still managed to deliver on the majority of our elective work. So well done, everybody. We also had a good week for discharge last week as well. So everybody was really came together as a team, as we do, but just to make sure that we were moving patients out of the hospital as quickly as we could as soon as they were fit for discharge. We are aware that we have a cohort of patients within our bed base that still are with us, unfortunately, with no medical reason to reside, but that they have, you know, many other challenges in terms of facilitating their discharge either to home or to another facility. So just to reassure everybody that we are tracking all of those patients. We're discussing them at what they call the City Silver meeting, which is where all of our citywide partners come together, and there's multiple MDT meetings that I know many of you are engaged in to try and facilitate those discharges as soon as possible. So I know some of you have those patients within you know, specialty areas, and they are in, I think, every single ward across the Children's Hospital at the moment. It's pretty unprecedented, but just to reassure everybody that we are wrapping ourselves around those patients and trying to really get everybody home or to their point of destination as quickly as possible. And then in terms of the week ahead, our pressures, particularly from a staffing perspective, are really across our neonatal intensive care and our crit care at the moment. And obviously often we borrow from one to the other at times like this when maybe one is pressured. So it's a little unusual that we've got such pressure across the two areas and we're not able to co-support in that way. So thank you to everybody that has supported those areas. We've had loads of Imagine shift uptake and nurses supporting, so that's working really well. So yeah, that's the week ahead really, Colin.
Thank you, Laura, and huge thanks to the staff, and of which we met and stuff last week, Laura, even coming and doing the Imagine shifts and making a real difference as well for the amount of patients we get through, so huge thanks to everybody. From a finance perspective as well, we are in a difficult position from the trust as a whole, and also that replicates where we are within the Children's Hospital. So we have a gap of 1.5 million. That is with our, despite essentially our reduction in our control total due to all the great work that everyone's been doing with waste reduction, and that the waste reduction in theory brings it down to 1.5 million, and the waste reduction work is accountable for £850,000. You know, there's huge amounts of work being done there, so really grateful. We also have seen some reduction, increase essentially in our waste reduction because of not having as many nurses come along, which is obviously a difficult thing. So although financially it makes us in a better place, it actually means that we can't deliver on some of the services. So, and that reduction is small. I think we were expecting 70, but I think probably 65 are actually coming to us. But it does make a difference financially, but then it puts a challenge into how we provide our services. We're leaving us in that position, which is difficult. Obviously, we want to engage with you as much as we possibly can do. And I think, Liz, you are there, and you've popped up just in time. Perfect. Liz, would you be happy to talk to us our current topic or whatever you want to highlight within waste reduction?
Morning, everyone. I'm not doing waste reduction this morning. I'm sharing. I've got absolute pleasure to share a really great example of some quality improvement works and pathway improvement work undertaken by Ward 52. So many of you will have heard of the SDR procedure, which is selective dorsal rhizotomy that Mr. Gooden, one of our neurosurgeons, undertakes for children with severe lower limb spasticity. And it's quite a life-changing operation that really improves the quality of life and mobility of the children treated. And the post-operative SDR pathway until recently required initial post-op care on HDU. And unfortunately, due to the high demand for HDU beds on a weekly basis, lots of children had their operation cancelled on the day because there was no HDU bed available. And some of those children were cancelled on more than one occasion, even up to 3 times. And obviously that's a really, really poor experience for the patient and their family. And also it's a terrible waste of surgical and theatre time, and it leads to knock-on delays for all elective neurosurgical patients. So the whole medical and nursing team wanted to take action to reduce the risk of cancellations, and they looked at what would be required in order to fast-track post-op patients straight back to Ward 52. And one vital element was the requirement for the ward nurses to be epidural competent. So they all set to and gained their competencies, and a new pathway was implemented at the end of April. And since then, 3 patients have had their SDR operations. None of them had a cancellation, so they were all treated on the day that it was planned to be, and they all received all their post-op care on Ward 52. So not only does this improve the SDR pathway by reducing the risk of cancellations and improving patient experience, it contributes to reducing waiting times by avoiding wasted theatre lists. And it also has a wider positive effect by reducing demand on HDU beds, which means that patients being treated by other specialties who also need an HDU bed also have a reduced risk of cancellation because the SDR patients aren't using those beds. So it's a really great example of a team working together to improve a pathway and the patient experience. So we'd really like to hear examples of other pathway improvement work that people have undertaken, or if you've got a pathway that you think needs improving but you don't know where to start, please get in touch, because yeah, as you can see from that, the benefits can be really, really immeasurable. Thank you.
Thank you very much, Liz. And as you know, it's funny because that came up, I think, when I started as deputy country director, gosh, about 3-ish years ago now. That was one of the things that they picked up within the neurosurgical and neurology team as a whole, is wanting to improve and change, and actually to have that now actually tangible and happening for patients is brilliant. So real thanks. And I was just replying to Raj as well about the comments about it's not just the surgery bit, and actually it's a massive team work that happens around the SDR that makes sure that pathway gets the best for its patients. If the surgery happened alone, the patients would suffer and actually come to harm by it. So it's a whole teamwork, and it's amazing. So huge thanks, and a good point to make, Raj. Thank you. But we have Celia back now as well, who's back from the visit of Toronto. And Celia was going to update us with what happened and points we can pick up on. Celia, over to you.
Thanks very much, and apologies if there's some background noise because we're having some building work done today and I'm at home. So I was really privileged to be part of a small team of us that visited Toronto Sick Kids and Toronto General Hospital, where the adult congenital service is run from. Last week there were 8 of us that went, and 2 people unfortunately weren't able to attend, but we had an intensivist, clinical nurse specialist from adult congenital, cardiologist, 2 cardiac surgeons, myself, and also theatre practitioner. Really good conversations throughout the week, a very busy week, their meetings start at 7 a.m. in the morning, and they finish, you know, at 6 and 7 p.m. at night. So very busy. I think the things that we've taken away are that actually we're doing a really good job here in Leeds, and that our outcomes are pretty much the same and sometimes a bit better. One of our surgeons, Giuseppe, has promised me that he is going to be taking forward minimally invasive cardiac surgery, so I'm going to hold him to that. Something he was interested in before anyway. In relation to transition, we are way ahead of the game compared to Toronto. We're also looking at some opportunities now in relation to exercise for children once they've had surgery, but starting looking at that from the age of 6 or 7, so that, you know, they're fit going forward into their adult lives. Obviously, my focus was on nursing structure, recruitment. The structure is very different to ours. There seems to be lots of different people at all different levels, which means that their meetings are very efficient. They've obviously been able to do lots of background work, and we found that throughout all the meetings we attended. But some of the ways that the meetings are conducted, I will definitely be taking ahead with the nursing team. So any nurses on here, watch this space. I think that's probably all for now. There will be more coming out over the coming weeks, but it was a great opportunity. Unfortunately, as 2 people couldn't go due to COVID, they will be going out towards the end of the year. So I'm sure we'll get some further information through from them. And another big focus, which I can't possibly forget, was the focus on cancellations and how we managed to reduce the cancellations, particularly of our cardiac patients, something that they've managed to do quite successfully with the same challenges that we have. Thanks very much.
Celia, and you delivered that with what sounds like they're building the Forth Road Bridge behind there. So I hope the works are still going well. And I think, you know, really grateful for the whole team in going and learning as much as they can do. As you say, you know, they were long old days, but actually you've gained massive insight into the best care as well. So thank you for those involved in setting up, and thank you for those going, and I'm sure we'll be learning actions for time to come. So I'm just going through the chat. Ed, I don't know if there's things that I haven't picked up on at all, but one of the big things, I'm glad to see Matthew is back with us. So, and cliffhanger has not happened, but I think raising further money and stuff going forward. So great work, Matthew, and really thankful for that. Ed, was there anything else I hadn't picked up on?
I think you were okay for questions, Colin. The only other thing was I think Celia was has got an AOB for us.
Yeah, so I guess touching on Matthew's comment in the chat, we're now on a 2-week countdown, just over 2-week countdown to the British Transplant Games being held in Leeds. With thanks to Matthew, we have managed to raise around 18,000 for the charity, which helps our children and families take part. You'll hear and see all sorts going on. If anybody wants to get involved, come and help us and support us, then let Lisa or myself know. I managed to recruit some people from the team that were out in Toronto last week, which is really exciting. So yeah, I think that's probably all. You'll hear so much about it in the coming weeks. So
yeah, and again, that you've brilliant team, yourself and Lisa driving everyone around as well to provide a great event that's going to be hosted here in Leeds. So it's a huge thanks to you, and something we can be really proud for years and years to come. So lovely to see you all. Stay safe with regards to the hot weather. Obviously, if you can manage to get out sun protected and get some vitamin D, that's a good thing, and it will help you all. But make sure you're hydrated, and I will look forward to seeing you all next week. Bye all.
bye.
Thank you.
Bye.